What's up, world? What's up? What's up? What's up? Hey, today is Friday. You already know what the deal is. We're going over NCLEX questions. Tell your mom, tell your friends, tell whomever you need to tell right now that we about to get into it. So, welcome. If you are new here, my name is Kevin. I am a nurse. I've been a nurse for 3.5 years. And today we are doing NCLEX questions. We do these questions every Monday, Wednesday, and Friday at 5:30. I get these questions off nurselabs.com. We go through them together. Participation. We have a good old time out here. So as you guys start to trickle in, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you kill that like button. Make sure you share and make sure you follow. Those three things right there get this live to the people that need it. Okay. And also, I want to know who you are, where you're from, and where you're at in your nursing journey. I think I already said that. I'm pretty sure I already said that. But if I repeat myself, whatever. So you're from Jamaica. Shout out to Jamaica. Shout out to you. I was stationed in Guantanamo Bay / deployed in Guantanamo Bay at one point. And that was my first real taste of authentic Jamaican food because we had a lot of Jamaican people that worked there that were the firefighters and stuff like that. Just I think I gained 15 pounds just eating nothing but Jamaican food. So it was great. What's up, Joanna? How are you? Shout out to all of y'all. Hey, so you already know what we're doing. We're doing NCLEX questions, waiting for people. Montego Bay, I'm going to go to Jamaica one day. I'm going to go to Jamaica and I'm going to hang out. So we made it, guy. Hey, yo, look, we made it to Friday. You know what I'm saying? But I'm trying to have it to where every day is a Friday. You know what I'm saying? Every day is the weekend, even though we're still putting in this work. But every day gonna be a weekend, you know. We're gonna enjoy every day, not just Friday and then dreading Sunday because we know we're going into Monday. You know what I'm saying? We gotta change this thought process. You know what I mean? However, hey, so I got one person tell me where they're from. Joanna, I don't care where you're from because you've already told me. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. We are doing NCLEX questions. Hey, once we get 100 people up in here, hey, it's on and popping. So I've only done this, I don't know, a handful of times. So once we get a good amount of folks up in here, I'm gonna turn this camera around so y'all don't gotta listen to me run my mouth, and we'll just, go to questions. I'll run my mouth while we go to questions. So, oh my God, how rude! What, Joanna? Look, hey, that's nothing but love. What you mean? What you mean? Fine, Joanna. Tell everybody where you're from and let us know where you are at in your nursing journey, Joanna. Since you feel so left out. Hey, we got 40 people up in here. So hey. I want to know who you are, where you're from, where you're at in your nursing journey. My name is Kevin. I'm a nurse. We're about to do NCLEX questions, but I want to know about you. Make sure you guys smash that like button. Make sure you guys follow. Make sure you guys share. Because if you don't, first of all, that's just kind of greedy, kind of rude. You know what I'm saying? However, this pushes the live out to people who need it, you know? So from Connecticut, we got somebody from Dallas. Shout out to you. South Carolina, 13-year RN. Shout out to you. The finger, I ain't done the, you know what I'm saying? But I ain't done the finger to a lot of people. I ain't done it in a while. For one more semester, hey, you almost there. Shout out to Ohio. Chirac, shout out to you. With Chi-Town Latina. Lord of mercy. What's up, Cass? Oh, God. Hey, Cass is here, y'all. I just want to let y'all know. Hi, Kevin. Is it Jacinia from, hey, so shout out. Is it Jacinia? Is that how you say it? Is it Jacinia or Yesenia? Because I know that, some of us are not, culturally inclined, so they say things wrong. You know what I mean? Hey, we got 114 people in here. Real quick, smash the like button. Make sure you share. Make sure you follow. We're doing NCLEX questions. I want to know who you are, where you're from, and where you're at in your nursing journey. But without further ado, I'll turn this thing around so nobody got to look at me. Okay, we got 100, so let's go. First of all, are you about to get banned? Scorpio, you finna get banned. Don't play with me. Hey, so what's up? We're doing NCLEX questions. Hey, make sure you guys participate. I know that's kind of far away, so let me bring it up a little bit. We're bringing that up a little bit. Baby Boots outside with his mama. So, hey, participate. That is the key. Make sure you guys participate. Give me them likes. Give me them shares. Give me them follows. Don't troll my chat. If you troll my chat, I'm gonna give you a 600, which means I'm gonna ban that ass. Don't test me because you'll lose that battle. I promise. I got these questions off nurselabs.com. 7-day NCLEX course. That's the course I created. $48. You get it. You get it forever. And if you need coaching on NCLEX, you guys can check out my link in my bio. Speaking of my 7-day NCLEX course, I am almost finished with the new generation NCLEX course review. And that'll probably be up next week. So there's that. Here we go. Question number 1. I just want to make sure everybody can see that. The client with suspected meningitis is admitted to the unit. The doctor is performing an assessment to determine meningeal irritation and spinal nerve root inflammation. A positive Kernig sign is charted if the nurse notes what? Pain on flexion of the hip and knees, nuchal rigidity on flexion of the neck, pain when the head is turned to the left side, or dizziness when changing positions. I just want to let you guys know, I give you guys about 30 seconds if you guys are new here, and then we go on and we read the rationales. What do we got? We got B's. Okay. Hey, if you're just, hey, Soup Deep. I see Soup Deep just jumping here. If you guys are new here, welcome. We are doing NCLEX questions. Got these off nurselabs.com. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Don't be greedy your whole life. I just had to chart this lady. Okay, I see you. Florida, shout out to Florida. I used to live in Florida. I lived there a little bit. All right, I'm going to give you guys 10 more seconds. You can't see. Open your eyes then, woman. Jamaica here. Shout out to Jamaica. Got another person here from Jamaica. Everybody, can y'all see? I'm an LPN program. Okay. Well, everyone else is giving answers but you, Scorpio Princess. But anyways, here we go. I love that you're doing this. I do this all the time. Monday, Wednesday, Friday. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A. Pain. Oh yeah, pain on pain on flexion of the hip and knees. Kernig sign is positive if pain occurs on flexion of the hips and knees. Kernig sign is one of the physically demonstrable symptoms of meningitis. Severe stiffness and hamstrings causes an inability to straighten the leg when the hips is flexed at 90 degrees. I need a refund for my degree. Look, I'm just saying. Hey, that's part of physiological adaptation. That's when some people come in here and they're just like, man, these are easy, but it's all about how they word it, right? But we don't. Let's look. We'll look at another one. What was that one? Because I'm pretty sure everybody picked B for the nuchal rigidity, right? So it also says severe neck stiffness causes a patient's hips and knees to flex when the neck is flexed. So different signs, Kernig signs versus Brukinski signs. All right. Shout out to all 180 something of y'all in here. We're going. Me, I need a refund. I barely know anything. That's okay. That's okay. I don't know nothing either. That's why I'm here. You know what I'm saying? That's why I'm here. But shout out to y'all. Question number 2. A client with Alzheimer's disease is being assisted with activities of daily living when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting what? Is it agnosia, apraxia, anomia, or aphasia? Got A, B's, C's, and D's. Shout out to all 140 y'all. If you guys are just joining, we are doing NCLEX questions. These are not my questions. I got these questions off nurselabs.com. So there's that. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys check out my link in my bio. I got a bunch of stuff over there. The difference between the new generation NCLEX and the old generation NCLEX is how the questions are delivered to you. That is it. So they added case studies. They added bow ties, fill in the blank / closed questions. Those are like the drop down ones. What else? They have anticipated versus not anticipated type of questions. Like, hey, what would I anticipate based off of what was given to me in my case scenario? Stuff like that. Okay. You still got your select all that apply. You still got your multiple choice. All right. I'm giving y'all 10 seconds. All right. Ren says A. Marissa says A. Okay. Okay. I see you. All right. Here we go. Here we go, y'all. Here's our answer. Here is our answer. And 3, 2, and the answer is agnosia. I know that is tiny because that is tiny for me to read. Agnosia is the term used to describe the loss of the ability to recognize what objects are and what they are used for. For instance, a person with agnosia might try to use a fork instead of a spoon, a shoe instead of a cup, or a knife instead of a pencil. With regards to people, this might involve falling or failing to recognize who people are, not due to memory loss, but rather a result of the brain not working out the identity of the person on the basis of the information supplied by the eyes. Yeah, so if you see somebody walking around with a fork, trying to pull an Ariel for the Little Mermaid and they're combing their fucking hair with it, probably not. Might want to look at might want to look at that. All right. Hey, what does I say? Psychosocial integrity. Okay. That's one of those one of the smaller sections on NCLEX, but definitely one of the most, definitely one of the important ones, right? Hey, it works though. You're right. That fork combing that hair works. I don't know. I ain't got hair like that, so I feel like I pull mine out. Anyways, here we go. Question number 3. The client with dementia is experiencing confusion late in the afternoon and before bedtime. The nurse is aware that the client is experiencing what is known as blank: chronic fatigue syndrome, normal aging, sundowning, or delusions. You know what? I feel like I'm gonna back this up some. I'm going to make this bigger so that way it don't look all weird. So give me a second, because I feel like it's not enough space. Make it bigger. Make it bigger. All right, I think that's better. Wow, thanks. 20 minutes ago. Oh, okay. My bad. Listen, we're all sundowning for real. I'm tired right now. And I'm gonna forget what I did. All right, here we go. Here's our answer, y'all. Here's our answer. Our answer is coming in 3, 2, and the answer is C, sundowning. Increased confusion at night is known as sundowning syndrome. This increased confusion occurs when the sun begins to set and continues during the night. The term sundowning refers to the state of confusion occurring in the late afternoon and spanning into the night. Sundowning can cause a variety of behaviors such as confusion and anxiety, aggression, or ignoring directions. Sundowning can also lead to pacing or wandering. Look, it'd be wild out there. So shout out to everybody that be taking care of sundown. I think I took care of like maybe 2 or 3, and had one of them try to fight me, and I'm just like, man, come on, I'm tired. It's like 2 o'clock in the morning. I'm trying to help you out. Can we watch the Golden Girls? I love Betty White, RIP to her. So I'm just saying, can we not do that? So shout out to y'all. Here we go. Question number 4. The client with confusion says to the nurse, I haven't had anything to eat all day long. When are they going to bring breakfast? The nurse saw the client in the day room eating breakfast with other clients 30 minutes before this conversation. Which response would be best for the nurse to make? Was it, you had breakfast 30 minutes ago? I feel like Sasha would say it like that. I am so sorry that you didn't get that they didn't get you breakfast. I'll report it to the charge nurse. I'll get you some juice and toast. Would you like something else? Or D, you will have to wait a while. Lunch will be here in a little while. What are we thinking? We got some C's, we got some B's. All right. Hey, if you guys are new here, we're doing NCLEX questions. I got these questions off nurselabs.com. Make sure you guys go over there and check that out. Hey, because free, hey, I like free. Some things are free, and those are the ones I like. All right. I'm going to give y'all 15 seconds. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. You guys share, you guys follow. Don't be greedy your whole life. You want to be a nurse, so you got to give up time and you got to give up part of your life. So that's just kind of how it is. All right, y'all, here we go. Shout out to Kenya. I see you out there. I ain't never been to Africa. It's definitely on the bucket list, though, for sure. All right, here we go. Here's our answer. In 3, 2, and the answer is C. I'll get you some juice and toast. Would you like something else? The client who is confused might forget that he ate earlier. Don't argue with the client, no matter how much you feel like you need to. Shout out to the NY. Simply get him something to eat that will satisfy him until lunch. Avoid challenging illogical thinking. Challenges to the patient's thinking can be perceived as threatening and result in a defensive reaction. Maintain normal fluid and electrolyte balances. Establish and maintain normal nutritional functions. With body temperature and oxygenation, blood glucose levels, and blood pressure. But my personality says A, but we know you, right? Shout out to all the follows. Who is that? Goddess, is it Kiba and Chape? I'm pretty sure I said that right. Or Chappie. All right, here we go. Question number 5. The doctor has prescribed Exelon. for the client with Alzheimer's disease. Which side effect is most often associated with this drug? Is it urinary incontinence, headaches, confusion, or nausea? Somebody said something bad in my live, filtered it out. I better be nice. I just did my first Code Blue simulation. I'm still on the adrenaline. Oh, just you wait until those Code Blues are real. Then you're really going to be like, well, what the hell? So shout out to y'all. Hey, make sure you guys smash that like button. You vote A. Okay, Bella, I see you. Make sure you guys smash that like button. Make sure you guys follow and make sure you guys share. That's the trifecta that TikTok wants. I need it. I need all that. All right. I want to know who you are, where you're from, where you are at in your nursing journey. All right. 15 seconds. Thank you for the follow, Savannah. B. Keon, why you got to yell? I feel like Keon's like, and then here I'm like, today, Junior. No, I'm just playing. Oh, my God. All right, y'all. Here we go. Here's our answer, y'all. Here is our answer. In 3, 2, and the answer is D, nausea. Nausea and gastrointestinal upset are very common in clients on, the acetylcholinesterase inhibitors, such as Exelon. Other side effects include liver toxicity, dizziness, unsteadiness, and clumsiness. The main adverse effect associated is gastrointestinal issues. The primary symptoms are nausea and vomiting. These acute effects primarily occur during the initial dose phase of therapy, upward dose titration of the drug to achieve the therapeutic dose. I hate the fact that this is so tiny. These events can be minimized by using a slow titration schedule and taking the medication with food if prescribed an oral formulation. So shout out to y'all. He said, gave me the monies. Okay, I see y'all. All right, here we go. Hey, that is part of pharmacology, pharmacological and parenteral therapies. That is the second largest section on the NCLEX, okay? So y'all remember that when you guys are studying for it. Hey, real quick, we're doing NCLEX questions. Make sure you guys like, share, follow. Commercial break. Give me all them likes. Don't troll my chat. If you troll my chat, I'm going to ban that ass. Literally, it says it. I'm going to ban that ass. Read it, okay? I got these questions off nurselabs.com, so you guys go check those out for yourself. I have an NCLEX course. It's $48. My NGN review is going up next week, so you guys check that out as well. And if you need one-on-one coaching with NCLEX, check out my link in my bio. And yeah, there's that. Thank you for the follow. Who's a Tracy Mama Nanny? Your name is Tracy. You're a mama and a nanny. All right, I'm tracking. I got you. Here we go. Question number 6. A client is admitted to the labor and delivery unit in active labor. You can't see? Open your eyes, woman. What the hell? I don't know what you want me to do. Everyone else can see. During the examination, the nurse notes a papular lesion on the perineum. Which initial action is most appropriate? Document the finding, report the finding to the doctor, prepare the client for a C-section, or continue primary care as prescribed. No, we can't see the whole question. See, she didn't state that. Thank you for clarifying and giving me context because, Scorpio gal, she ain't doing it. All right, let me know. Can you see it now? You can see the whole question? I can see the whole thing. Okay, see, people be out here blind. You know what I'm saying? Y'all blind. All right, is that better? Good. Okay. All right, cool. Janice, thank you for the follow. I'm going to give y'all 20 seconds. I had to move that, so I don't know if that affected anybody. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you smash that like button. The highest likes I've gotten is like 55,000 likes. Hey, it would be great at one day that I could get back there. Everybody's screaming B. Okay. Screaming B. Southwest, like the airlines. That's the cheapest flight I'll ever go. Don't ever ask me to go Spirit. Don't ever ask me to go Frontier, because what is wrong with you? All right, here we go. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. Shout out to Maine. What you mean liberal? Oh, we ain't even going there. All right, here we go. And the answer is B. Report the finding to the doctor. Any lesion should be reported to the doctor. This can indicate a herpes lesion. Clients with open lesions related to herpes are delivered by cesarean section because this is a possibility of transmission of the infection to the fetus with direct contact to the lesion. During pregnancy, there is a higher risk of perinatal transmission with primary HSV infection than with recurrent infection. If a primary HSV outbreak is diagnosed in pregnancy, oral antiviral treatment may be administered to help reduce the duration and severity of symptoms and viral shedding. My bad, y'all. I've been recording all damn day and now I'm tired, but I'm out here for y'all. So finished my CMA starting RN in January. Is it Brianna? Shout out to you. Shout out to you, Brianna. Miss T, hey, don't be laughing at me, okay? I got a code. Be right back. All right, go handle it. Go handle it, and then, have fun. Here we go. Question number 7. A client with a diagnosis of HPV is at risk for the following. Is it Hodgkin's lymphoma, cervical cancer, multiple myeloma, or ovarian cancer? Oh, my God. Appreciate the follows. Thank you. Hey, I got these questions off nurselabs.com. Quick little note about me for those that are new is I have been in the Navy for 16 years. So your boy is almost out the door. Been a nurse for 3.5 years. Worked in the ICU, worked in the PACU, and I worked in the OR. 15 seconds. Make sure you guys smash that like button, you share, and you follow. Shout out to all 450 y'all in here rocking with me. Kevin, you need to take a break. I didn't even see the rest of that. What'd you say? Kevin, you need to pre-hearing. I'll be waiting for you here. Don't worry. Hey, look, I appreciate you. I'm going to take a break. All right, here we go. Why am I here? I'm a teacher. Because you want to hang out. That's why. All right, here we go. There is our answer. The answer is B, cervical cancer. The client with HPV is at higher risk for cervical and vaginal cancer related to this STI. The human papilloma virus is the initiating force behind multiple epithelial lesions and cancers, predominantly of cutaneous and mucous surfaces. Today, HPV has been implicated as a cause of laryngeal, oral, lung, and is it the anal genital cancer? I'm not reading the rest of that because I feel like it's irrelevant. But anyways, we all know what's up. Appreciate all 470 something of y'all up in here. We're going to go to the next question. I want to know who you are, where you're from, where you're at in your nursing journey. Let's spark up a conversation down there in the bottom of the chat. Smash that like button. Make sure you guys share, you guys follow. Question number 8. During the initial interview, the client reports that she has a lesion on the perineum. Further investigation reveals a small blister on the vulva that is painful to the touch. The nurse is aware that the most likely source of the lesion is what? Syphilis, herpes, gonorrhea. Condylamina, condylinus rice, whatever. Is it condylomata? Prior Army, shout out to you. Elvian. Got bees, okay. Bees. Heroes. Bella. Who's a hero? Oh, you meant herpes. Oh, okay, I got you. You're typing too fast out there. You're typing too fast. I'm a PA. Just a chronic pain warrior, so I have to learn a lot about my... Hey, shout out to you. Oh, you're NPA or you are APA? I mean, either one is cool. All right, 10 seconds, y'all. Karen and Katie, thank you for the follows. Appreciate y'all. The Condi is a parasite. I'm in PA. Oh, okay. I know some folks up there. All right, y'all. Your review is so helpful. Laura, I'm glad. Thank you for telling me that. That really makes me happy. I'm glad that it's helping somebody. All right, here we go, y'all. Here's our answers. In 3, 2, and the answer is B. It's herpes. A lesion that is painful is most likely a herpetic lesion. Herpes... herpes can be caused by the herpes simplex virus type 1 and 2 and manifests as either a primary or reoccurring infection. Most commonly, viral replication occurs in epithelial tissue and establishes dominancy in sensory nerves, reactivating periodically at localized recurrent lesions. It remains one of the most common sexually transmitted infections, but continues to be underestimated, giving the vague presentation of its symptoms. So shout out to everybody that picked B, and make sure you guys know about these disease processes, right? Especially if you guys have gone through pathophysiology, which I'm pretty sure a bunch of everybody has if you're in nursing school at some point, or you will go through it. Hey, knowing the disease processes and how they affect the body is super important, okay? Ann says, what time are you live for this? I go lives every Monday, Wednesday, Friday at 5:30, all right? Central Standard Time. Here we go. Question number 9. A client visiting a family planning clinic is suspected of having an STI. The best diagnostic test for the Treptomina pallidum was it a venereal disease research lab, plasma or rapid plasma Reagan fluorescent? Oh my God, is it treponel, antibodies, FTA, whatever, and then the Thayer-Martin culture. Hey, I already told y'all I'm not a 10-year-old getting ready for a spelling bee. So treptonemo, whatever. Everybody be putting the sayings down there, so I appreciate you. Definitely C. All right, Tay, I see you. Berna says, nah, it's B. Okay, all right. I'm going to Charlie one. All right, y'all, here we go. Somebody just said it down in the chat. Something about the question. Hey, if you guys are curious on why I got these questions, I got them off nurselabs.com. All right. That's where I got them. They're free. You guys can go over there and check them out. They have their own comprehensive little exams and all that good jazz. So, no, Berna, it's too late. It's too late. Here we go. Here's our answer. It is C. All right. What is it? The FTA is the test for the treptonemal pallidum. The FTA test is the blood test that checks for the presence of the antibodies. These bacteria cause syphilis. Syphilis is an STI that spreads through direct contact. You got it right. Shout out to you. Shout out to you for getting it right. I am so sorry, y'all, that this is so small, but I really wish that I could make this bigger. But I should start trying to stream on the computer. But then somebody told me no, to keep doing it like this because they like this better. And I'm just like, all right, whatever. This is like 3 answers right so far. Shout out to you, Ann. Here we go. Question number 10. A 15-year-old prima gravida is admitted for a tentative diagnosis of HELP syndrome. Which lab finding is associated with HELP syndrome? Is it elevated blood glucose, elevated platelets, elevated creatinine clearance, or elevated hepatic enzymes? Hey, this is a good question. Platelets. All right, Cassie, I see you. Shout out to all 300 plus of y'all in here. If you guys are new here, welcome. Make sure you guys smash that like button. I had it myself. Oh, okay, girl. I mean, I don't know if I did. I believe you. I believe you. Hey, make sure you guys smash that like button. You guys share, you guys follow. That is the trifecta that TikTok likes, and that's what I need. So give me what I need and give TikTok what they like. All right. Please, where are you getting these from? I got them from nurselabs.com. You'll hear me say it all the time. Elevated hepatic enzymes. All right. Screaming at me. I had it as well. 51,000 platelets. A lot of mercy. All right. I'm going to give y'all 10 more seconds. When I go through the, this is why it's so important, y'all. Somebody just asked if I could give an explanation of what the HELP syndrome is or what HELP syndrome is. When I go through the rationale, that gives you your explanation. That's one of those things that I hit on super hard when you are studying for your NCLEX or any exam. Okay. So once we go through the rationale, you'll know what the answer is. All right, here we go. It's from preeclampsia. Look at you, Amanda. You smart. All right, here we go. And 3, 2. And the answer is D, elevated hepatic enzymes. The criteria for HELP is hemolysis, elevated liver enzymes, and low platelet count, right? So technically, for those that decided that they wanted to say the platelet count, you're not wrong, but that's not the answer that it's looking for. The syndrome of HELP has historically been classified as complication of progression of severe preeclampsia, right? It's a bleeding issue. Yep. Genetic analysis of the inheritability of predisposition for preeclampsia and or HELP syndrome in pregnancy has also been explored. Results show both genetic and immunologic factors that play a role in this disease process. Okay, so that is why it is so important, y'all, that y'all read the rationales. Like, people are just like, I don't want to read them, or they're too long. I don't give a shit if they're too long. You better read them. It's you trying to get a license, not me. I have people argue with me with it all the time, and I'm just like, hey, do you in the end. I guess I'll just, talk to myself. Real quick. Hey, so commercial break. Hey, make sure you participate. Give me all them likes. Don't troll my chat, because if you troll, I'ma ban that ass. That's exactly what I'm gonna do. All right. I got these questions off nurselabs.com. Check out the 7-day NCLEX course. Somebody told me in the chat that it's helpful, and I'm so glad it is. $48, it's yours for a lifetime once you get it. And if you need coaching one-on-one on NCLEX, check that out. That link is in my bio. All right, here we go. All right, question number 11. The nurse is assessing the deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the bicep reflex? All right. I'm not going to read it all. You guys can read it. You guys just scream it out to me. I'll give you 30 seconds. Shout out. Thanks for everybody for the follow. Appreciate you. What we got? What our answers is? All right, Pumpkin, I see you. Pumpkin got an A. All right. Got A's out here. Okay. If you guys are new here, make sure you guys keep smashing that like button. You smash that share button and you follow. Laura says, A. Ortho resident, this is a piece of cake. Well, that's because you're an ortho resident. So, if you're an ortho resident, that means you done already been through med school. So I would hope that you would know this. 10 seconds, y'all. Nina says, A. Riding around with that, Nina. All right, I'm done. All right, y'all. Soup Deep says A. Okay. All right. Shout out to y'all. All right. Here we go, y'all. Here we go. Here is our answer. Our answer coming in 3, 2. Berna, what you crying about? And the answer is A. The nurse places her thumb on the muscle inset of the anticubitical space and taps the thumb briskly with the reflex hammer. The bicep reflex is elicited by placing your thumb on the bicep tendon and striking the thumb with the reflex hammer and observing the arm movement. Repeat and compare to the other arm. Using a reflex hammer, deep tendon reflexes are listed in all 4 extremities. Note the extent or power of the reflex, both visually and by palpation of the tendon or muscle in question. All right. So shout out to y'all. What is it? Like this taught, that's taught in health assessments. All right. Appreciate the follows. You forgot about that. That's okay. That's okay. Honestly, it's like when you see it on paper and you can't really see it like visually, like how it's happening, a lot of people forget. So it's okay. Hey, but reading your rationales, that's by far the most important thing that you have to do. Okay. I learned it in funds. Oh, so you can see now? You can see now, Scorpio? Oh, okay. I learned it in funds. I'm just playing. The NCLEX is stressful. It is stressful. It's a very stressful and it's a difficult exam. I don't care what nobody will tell you. Question 12. A prima gravida with diabetes is admitted to the labor and delivery unit at 34 weeks gestation. Which doctor's order should the nurse question? So what is wrong? What is out of the ordinary, right? Magnesium sulfate 4 grams IV. Was it a breathine at 4 micrograms IV? Is it Statal 1 gram IV push every 4 hours as needed PRN for pain, or Ancef 2 grams IV piggyback every 4 hours? Mine is on Tuesday and I'm crying. Hey, don't cry. Don't cry and don't be scared, because if you're scared, go to church. Don't be afraid of it. If you've been preparing for it, you'll be good to go, right? But if you don't know it by now, you don't know it at all. It's not all about memorizing. It's all about being prepared. And yes, it's all about perspective. All about perspective. Right? You got to prepare for it. I don't know anybody that's gone and taken that exam and not prepared for it. 10 seconds, y'all. What is E? We don't even got E on here, guy. What do you mean? Mine's tomorrow. We got this. Crocker, if yours is tomorrow, go away. Get off. Go away. You need to go chill and relax and you need to go chill and relax as much as possible. All right? So if you got your NCLEX tomorrow, anybody on here, go away. Go away. All right, y'all. Here we go. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. Is it breathing is used cautiously because it raises the blood glucose. Terbutaline, can cause a temporary increase in the baby's heart rate and blood sugar levels. These side effects usually aren't serious and are easy to treat after delivery if they occur. There are concerns about long-term use of this drug because the incidence of danger to the baby increases. You've never heard of it? I'm not even gonna lie to you. First time I ever heard of that med. Not even gonna lie to you. So honestly, I would have definitely guessed. So here's the thing. You can't apply what you don't know, but you have to be able to apply what you do know. So based off of what you do know, right? We talk about magnesium, right? We talk about Ancef, right? Which is an antibiotic. Can a pregnant woman get an antibiotic? Can a pregnant woman get magnesium? You know what I'm saying? So you could do, that's how you do the process of elimination. And it's not a trick because you're applying what you know, right? It's not a trick. Yes, the process of elimination based off of what you know, not applying what you don't know, because you don't know what you don't know. You know? All right, here we go. I'm just keeping it all the way real. All right, here we go. Here we go. They give magnesium for preeclampsia. Look at that. Question 13. A diabetic multigravida is scheduled for an amniocentesis an amniocentesis at 32 weeks gestation to determine the LS ratio and the phosphatidylglycerol level. The LS ratio is 1-to-1 with the presence of the whatever that is. I don't even care. Is noted. The nurse assessment of this data is what? You got C? Cool. Hey, if y'all know how to pronounce it, go ahead and drop the pronunciation in there, since you know your boy is preparing for a spelling bee. It's like trying to spell supercalifragilisticexpialidocious. See, I can say that. Mohammed, thank you for the follow. Is it Devin? Thank you for the follow. To be honest, I don't know this one. That's okay. That's okay, Amanda. So here's the thing. If you don't know it, guess. RT here. It's C. Shout out to you. Shout out to all my RTs, my CNAs, my occupational therapists, shout out to all my LPNs, LVNs. I love y'all. You know what I'm saying? I love everybody that is a part of, the ancillary team. Dead ass. All right. 10 seconds, y'all. 10 seconds. Did I have anybody pass the NCLEX? Anybody pass the NCLEX since Monday? Had 3 people come in here and tell me they passed the NCLEX on Monday. I want to know if anybody registered midwife. Shout out to you. All right, y'all. Here we go. Here's our answer in 3, 2, and the answer is C. The infant is at high risk for respiratory distress syndrome. So shout out to the RT. Yes, we will pass. I know that's right. NP school. Okay, shout out to you. When the LS ratio reaches 2-to-1, the lungs are considered to be mature. What is it? The LS ratio is one of several methods for clinicians to assess fetal lung maturation. The biochemical test was first introduced in the 1970s, where a sample of amniotic fluid was collected via amniocentesis to determine the risk of the neonate developing respiratory distress syndrome. All right. So it's all about respiratory distress syndrome. EMT and paramedic school here. I got it right. Shout out to you, Samantha. Sam. Can I call you Sam? I'm going to call you Sam. All right, here we go. Shout out to y'all. My NCLEX is November 7th. Is Archer a good tool? Sure is. I think Archer's great. Archer's pretty good. All right, Sam. I'm calling you Sam. All right, here we go. Question number 14. I appreciate everybody rocking with me. Are you studying for NCLEX? Am I studying for NCLEX? No. I've been a nurse for 3.5 years. I worked in the ICU, I worked in the OR, and I worked in PACU. I currently work in the OR right now. So UWorld is cool. I think UWorld is okay, but UWorld doesn't give you content. And I always recommend people getting content. That meat and potatoes. Content, Q&A with rationales. So shout out to them. Question 14. Which observation in the newborn of a diabetic mother would require immediate nursing intervention? Crying, wakefulness, jitteriness, or yawning? We got C's everywhere. C's get degrees, I guess, as they say, right? Jitteriness. jitterness. I'm in nursing school too. Shout out to you, Berna. Shout out to you. Appreciate all 272 of y'all rocking with me. If you guys are new here, we're doing NCLEX questions. Got these off nurselabs.com. Make sure you guys like, share, and follow. Smash that like button. Give me a follow and give me a share. March 2024. Can't wait. It's right around the corner. It'll come faster than you think. All right, y'all. Here we go. Here's our answer in 3, 2, and the answer, of course, is jitteriness. Jitteriness is a sign of seizure in the neonate. For infants presenting with clinical signs compatible with hypoglycemia, like apnea or apnoea, hypotonia, jitteriness, apathy, hypothermia, tremors, and seizures, treatment must ensure that blood glucose levels are above 0.45 grams per liter. An IV bolus dose of glucose should be administered urgently, followed by a consistent rate infusion. All right, I'm taking my NCLEX soon. Hey, like I said, if you're taking your NCLEX tomorrow, you don't need to be on here. You need to be relaxed and getting that mind right. Because if you're over here trying to study and cram, if you don't know it by now, you don't know it at all. I'm just being completely honest. I had an instructor tell me that a long time ago, and I truly believe it. So you guys want to definitely prepare. If don't be here. Just go and watch a movie or do something. All right, here we go. Britt Gibson? Hey, shout out to you. Appreciate the follow. Question 15. The nurse caring for a client receiving IV magnesium sulfate must closely observe for side effects associated with drug therapy. And an expected side effect of magnesium sulfate is what? Decreased urine output, hypersomnolence, absence of knee-jerk reflexes, or decreased respiration, or decreased respiratory rate, CNS and respiratory depression. Okay. We all so smart. Oh, Princess is answering. Scorpio Princess is answering, so that's telling me she can see. Just finished OB and P's the class. Oh my god, class. Okay. Is it Eileen? Is it not Eileen, but Ella. We'll say Ayella. Is it Ayella? All right, y'all. 10 seconds. Papa says E. Wow, you trying to be funny? Trying to be funny, guy? F? Okay, cool. What other letter you got? Hey, you got 24 more to choose from. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B, hypersomnolence. The client is expected to become sleepy, have hot flashes, and be lethargic. Okay. Patients most commonly complain of minor facial flushing and warmth with administration. However, symptoms typically resolve spontaneously. In clients with neuromuscular disease, such as myasthenia gravis, the neuromuscular function may become worse at lower concentrations of medication. All right. Who is that? Whoa. Is it Yvette? Thank you for the share. Appreciate the follow from Whoa. Appreciate everybody. All right. So, I wouldn't expect. Yeah. Unexpected, but expected. Right. Yeah. So you got to know, like, if you're going to give a medication, what is the expected outcome of me giving this medication? Like if I have a patient with high blood pressure and I give them, a diuretic, or if I give them a beta blocker, I would expect for their heart rate and their blood pressure to go down. Right. Hey, quick commercial break. Participate. I appreciate everybody participating. Give me all them likes. Give me all the love. Make sure you guys share. Make sure you guys follow. Don't be greedy. Don't troll my chat. You troll my chat, I'm going to ban that ass. So people you want to come in here and test me, I'll ban you. Dead ass. Try me. Hey, I got these questions off nurselabs.com. You guys can go over there and check those out for yourself, especially if you're in nursing school. They have NANDAs and all that good jazz over there. 7-day NCLEX course. You get it for a lifetime. It's $48 right now, and it's going to go up eventually. So, hey, if you need an NCLEX course and you're taking your NCLEX in the next 3-6 months or the next year, hey, tell people, hey, I got an NCLEX review for $48. They're going to be like, where? Link is in my bio. And also, if you need one-on-one coaching, like for NCLEX, check out that link. That is also in my bio. Here we go. What's your dream nursing job? My dream nursing job for a while was to be a CRNA. And now I don't want to do that anymore. And now my dream nursing job, honestly, is to teach. thoroughly love teaching. I've been an instructor slash educator for like 8 years while I was active duty in the Navy. I taught surgical technology. I taught a bunch of other courses as well over the years. So education is where my love and my passion's at. So I know you love teaching. Joanna, it's like you're here all the time. So question 16, the client has elected to have epidural anesthesia to relieve labor pain. If the client experiences hypotension, the nurse would what? Place her in T-Berg position, decrease the rate of the IV infusion, administer oxygen via the nasal cannula, or increase the rate of the IV infusion. What are we thinking? What are we thinking? Shout out to all 260 of y'all. Hey, if you are new here, we're doing NCLEX questions. Got them off nurselabs.com. I want to know who you are, where you're from, where you are at in your nursing journey. I had somebody in my live last time tell me they were from Nepal, and I was like, Mount Everest, Nepal? They're like, yeah. And I was like, damn. Like, can you be like my tour guide up the mountain? They told me no, but whatever. 10 seconds, y'all. Lansing, Michigan. Okay. Hey, you're stuck between A or B? Give me one. Oh, you said B? I see you. I am also from Nepal. Oh, man, shout out to y'all. I didn't even know I made it all the way over there. You're from Gambia, West Africa. Shout out to y'all. Hey, with all the craziness that's going on in the world, I really love for the fact how something like this can bring us all together. Like, truly, truly. All right, here we go, y'all. Here we go. Here's our answer. Shout out to Canada. Canada, I see you. H-Town. All right, here we go. Here's our answer in 3, 2, and the answer is D, increase the rate of the IV infusion. If the client experiences hypotension after an injection of epidural anesthetics, the nurse should turn her to her left side, apply oxygen, and then speed the IV infusion. If the blood pressure does not return to normal, the physician should be contacted. Epinephrine should be kept for emergency administration. Yeah, shout out to you. You got it. You got it. Appreciate the love. Appreciate the follow. Is it Roman? Is it Pratima and Katie? Thank you for the follow. IV fluid will increase blood volume. Yep, sure will. You got it. You got it. Y'all some smarty pantses. I got some smart folks up in here. That's what I'm talking about. Question 17. A client has cancer of the pancreas. The nurse should be most concerned about which nursing diagnosis. Is it alteration in nutrition, bowel elimination, skin integrity, or ineffective individual coping? What's up, Sam? Samantha, I see you. Hey, if you guys are new here, make sure you guys keep smashing that like button. What does it say? It's like, I'm in nursing school. Your videos motivate me. Oh, I appreciate you, Samantha. What videos are you looking at? Are you talking about like my lives, or did you buy my course? Like, you gotta let me know. Let me know which one. All right, we got A's. Sarah and Rita, thank you for the follows. Yeah, but make sure you guys smash that like button. You guys share, you guys follow. We're doing NCLEX questions. I got them off nurselabs.com. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A, alteration in nutrition. Cancer of the pancreas frequently leads to severe nausea and vomiting and altered nutrition. Weight loss occurs in about 90% of patients. Abdominal pain occurs in about 75% of patients. Weakness, paresis from bile salts in the skin, anorexia, palpable, non-tender, distended gallbladder. Is it a colic? Yeah, a colic stool, and dark urine. Hey, so here's a fun fact. Steve Jobs, the founder of Apple, he died from pancreatic cancer because what's the number one way? What's the number one way that you can get acute pancreatitis, as well as it could develop into pancreatic cancer? I do lives Monday, Wednesdays, and Fridays at 5:30. Bad diet, right? But what's a big contributor? What is a big contributor? Alcohol. Yes, alcohol. I had a friend who I went to school with, who I was in the Navy with. He died, and he was young. He's probably and I'm 35, and he was 30. He's 2 years younger than me, and he died from pancreatitis because he was a binge drinker. It was bad. It was really, really bad. So. Here we go. Question 18, about to say 28. Question 18. The nurse is caring for a client with ascites. Which is the best method to use for determining early ascites? Is it inspection of the abdomen for enlargement, bimanual palpation for hepatomegaly, daily measurement of abdominal girth, or assessment for a fluid wave? What are we looking at? What are we looking at? Shout out to all three, almost 400 of y'all up in here. I want to know who you are, where you're from, where you are at in your nursing journey. Make sure you smash the like button. Make sure you follow. Make sure you share. Don't be greedy your whole life. We're doing NCLEX questions. I got them off nurselabs.com because that's free. And everybody know that free don't mean shit to me, but it's for y'all. So FYI, I used Nurse Labs while I was in nursing school as well. So it's especially for the nursing diagnosis. Loved it. All right. 10 seconds, y'all. Canada, eh? Shout out to Canada. I'm going to go up there one day. From Israel, not a nurse, but interested. You're from Israel. Is it Talia? Is it Talia? That's how you say it. Shout out to Israel. Shout out to y'all. A lot going on in this world. A lot going on over there. Hope everybody over there is being safe. Hope you're safe. All right, y'all. Here we go. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. Michigan. Abigail, get out of here. I'm just playing. Here we go. Answer is C. Daily measurement of abdominal girth. Measuring with a paper tape measure and marking the area that is measured is the most objective method of estimating ascites. Ascites is a pathologic accumulation of fluid within the perineal cavity. It is the most common complication of cirrhosis and occurs in about 50% of people with decompensated cirrhosis in 10 years. The development of ascites denotes the transition from compensated to decompensated cirrhosis, right? So what causes ascites? Give me some ways. Give me some ways that you can get ascites. I overthought that one. Hey, you always hear me. Hey, Joanna, let them know what RTFQ means. I say RTFQ all the time. Liver failure, right? Heart failure, right? There you go. Alcohol. So shout out to all my people that like to drink, because if you like to drink, that's what happens. Cirrhosis of the liver. What creates cirrhosis of the liver? There you go. Alcohol. Hey, but shout out to everybody that like to turn up on the weekend. You know what I'm saying? You know what I'm saying? So, hey, I'm just saying. We out here learning, baby. We out here learning. Question 19. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include a blood pressure of 80/34, Lord of mercy, a pulse of 120, and a respiration of 20. Which is the client's most appropriate priority nursing diagnosis? Is it alteration in cerebral tissue perfusion, fluid volume deficit, effective airway clearance, or alteration of sensory perception? All right, so let's think about this. They've given you essentially everything that you need. We have our blood pressure, we have our heart rate, and we have our respirations. What's the most important one that's there? 15 seconds. E, anxiety, really? Is that what you got, Ace? Because we got C. Okay, so somebody said airway, right? All right, BP is low, right? So you have to differentiate based off of your ABCs. Based off of your ABCs, you have to determine which one takes priority. Is it the A, is it the B, or is it the C? If I gave you if somebody had a blown off leg right now and they were hemorrhaging from their femoral artery, are you going to go up to their face and give them CPR? All right, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is fluid volume deficit. Fluid volume deficit, y'all. All right. What was a key giveaway from that was our blood pressure. Nurse Kevin, how many nights do you do live? I do these Monday, Wednesdays, and Fridays, so 3 times a week. 5:30 Central Standard Time here in the United States, specifically in Texas. The vital signs indicate hypovolemic shock. Monitor and document vital signs, especially blood pressure and heart rate. Decrease in circulation blood volume can cause hypotension and tachycardia. Alterations in heart rate is a compensatory mechanism to maintain cardiac output. Usually the pulse is weak and may be irregular if electrolyte imbalance also occurs. Hypotension is evident of hypovolemia. Okay. Hey, if you have somebody who has a low blood pressure, they are bleeding out somewhere. Either, I don't know, like abdominally, an extremity, their ass, doesn't matter. They're bleeding out of somewhere because your blood pressure is telling you that they're not perfusing correctly. Okay. Here we go. Question 20. My nudes in my bio. Hey, first of all, why would I go to your bio to go get nudes? Okay. Why would I do that? All right, here we go. Y'all read that because you already know what I'm doing. I'm giving somebody a 600 because you can't be, hey, we can't be doing nudes up in here. You know what I'm saying? That ain't cool. Hey, can you watch the video I posted with the doctor telling me the answer? I mean, I won't watch it right now. What do you mean? I'm not going to go check her bio. If you don't give me a picture, drop it in the chat so everybody can see it. No, I'm just playing. Yeah, I ain't gonna have enough time to watch this or to read this, so I'm gonna just let y'all answer it and we'll do the rationale together. All right, y'all. 5 seconds. Lady Ra. Hey, I'm just saying. Here we go, y'all. Here's our answer in 3, 2, and the answer is A. Likes to play football. Okay, a client with osteogenesis imperfecta is at risk for a pathological fracture and is likely to experience these fractures if he participates in a contact sport. The client might experience symptoms of hypoxia if he becomes dehydrated or deoxygenated. Extreme exercise, especially in warm weather, can exacerbate the condition. Poor Kipner, right? Osteo equals bone, correct. Correct. Shout out to all 500 plus of y'all. Thank you for, is that Lala and Aaron? Thank you for the follow. Appreciate y'all. We're going to go on to the next question. All right. Hey, real quick, commercial break. Don't you go nowhere. None of y'all. All right. Make sure y'all participate. Give me all them likes. I'm kind of funny sometimes. You know what I'm saying? Give me all them likes. Give me all them shares. Give me all them follows. Hey, that's what the trifecta of TikTok wants. Don't come into my chat being stupid or trying to give me your nudes. OK, don't do it. Don't do it. If you come up in here and you act a fool, I'm giving you a 600. I'm going to ban that ass. OK, nurselabs.com is what is where I got these questions. You go over there and check it out for yourself. 7-day NCLEX course. It's still in its pre-launch, so we're updating all the time. $48. You get it for a lifetime. And if you need one-on-one help with NCLEX, check out my link in my bio. 15-minute free call. All right. Somebody asked what the NCLEX was. The NCLEX is the nursing examination to get your license for RNs, for registered nurses and licensed practical nurses and licensed vocational nurses, depending on where you live. All right, here we go. Question 21. The nurse working the organ transplant unit is caring for a client with a decreased white blood cell count. During evening visitation, a visitor brings a basket of fruit. What action should the nurse take? Allow the client to keep the fruit. Place the fruit next to the bed for easy access by the client. Offer to wash the fruit for the client. Tell the family member to take the fruit home. D, sorry, Stephanie. What you mean? I didn't see what your answer was. F, is it cat? Come on, cat. Neutropenic. No fresh foods. Oh, why not? Why not no fresh foods? Take it home and get it out of here. Get that shit out of here. No fresh foods. Okay. All right. Bacteria. All right. 5 seconds, y'all. It's because it's bacteria in the food. Okay. Compromised immune system, not immunosystem. Bacteria. White blood cell count is low. Immunocompromised. Neutropenia precautions. Look at y'all. Y'all so smart. What drove you to get your BSN? Well, I'll tell you that story here in a second. Here we go. Here's our answer in 3, 2, and the answer is D. Tell the family member to get that shit out of here. Don't tell them exactly that. They may report you to HR. All right, here we go. The client with neutropenia should not have fresh fruit because it should be peeled or cooked before eating. Okay. He should also not eat foods grown on or in the ground or eat from a salad bar. The nurse should remove potted or cut flowers from the room as well. Any source of bacteria should be eliminated, right? Also think about water, right? Think about where cancer patients, when you're on a cancer floor or oncology, where do you get the water from, right? Do we get it from the faucet? Do we go to Fiji and we scoop it up in a bottle and bring it back? You know, like, what do we do? What do we do with it? All right. Yeah, not for NCLEX. Hold on, y'all. I'm on it today. I done banned 2 people. That's what I'm talking about. All right, y'all. A reduction of risk potential. There is special water. Yes, it is. There is special water for oncology patients. And somebody asked me why I wanted to get my BSN. Well, I was active duty in the Navy for 14 years. And in order for you to commission as an officer, you have to have your bachelor's. And so that's the main reason. I didn't even know you could get your associate's degree as a nurse. Did not know you could do that until I had already became a bachelor's degree nurse. That was it. Here we go. Question 22. The nurse is caring for a client following a laryngectomy when suddenly the client becomes unresponsive and pale with a blood pressure of 90/40 systolic. The very first thing the nurse action should be what? Place the client in T-Berg, administer infusion of dextrose and normal saline, administer atropine, move the crash cart to the bedside. What are we thinking? Holy hell. Hold on a second. I missed all y'all's answers. All right. What are we thinking? We got some C's, got some A's, D at this point. D at this point. We got some A's. We got some D's. That's yell help. Look, you yell help, scream help, hit the code blue button, do your little dancey dance, whatever. Would D require you to leave the patient though? Oh, look at you. Least invasive to most invasive. Right. Think about that, right? Because you shouldn't leave the patient's side. Why shouldn't you leave the patient's side? The patient is already unresponsive. Look at that. You're right. This is perfect world. Hey, because on NCLEX world, you have the order, you have all the help, you have all the hands, all that stuff. All right. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B, increase the infusion of dextrose and normal saline. I don't even, what? I love this. Thank you for sharing. You're welcome. Oh my God. Hey, it's okay. Dextrose and normal saline is indicated as a source of water, electrolyte, and calories. That doesn't seem right. We're reading the rationale to find out why. Hey, we're reading the rationale to find out why. Don't be yelling at me, okay? These ain't my questions. All right. Early complications after a total laryngectomy are bleeding, postoperative edema, and airway compromise. These, especially in the immediate post-operative, should be carefully monitored. I'm not even gonna lie, that's a terrible question. Honestly, that's a bad question. That's a bad question. And here's the thing, I don't agree with that question, because if I had somebody who's unresponsive and they have a blood pressure that's 90 over whatever, yo, I need help. Help me. I need help. Right? But you can't leave if your patient's already responsive or unresponsive, necessarily can't leave them, right? You got to wait for people to bring them to you. It's a very dumb question, not my question. But hey, out of a span of 100 questions, 5 or 6 of them or 8 of them could just be completely out the door, not make any sense, right? But it doesn't mean just because you have a question like that doesn't mean that you should fail your exam, right? Board of Nursing need an order for normal saline. Also, Board of Nursing, what do you want to do? Facts, right? Facts. All right, y'all, here we go. Question 23. The client admitted 2 days ago, the client admitted 2 days earlier had a lung resection, accidentally pulls out the chest tube, right? Which action by the nurse indicates understanding of the management of chest tubes? Order a chest x-ray, reinsert the tube, cover the insertion site with a Vaseline gauze, or call the doctor. Ooh, call the doctor. Shout out to all 400 plus of y'all. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. I need that. I need all that. And I mean all that. Like that DAT. That's what I need. All that. You know what I'm saying? Hey, we're doing NCLEX questions. I got these questions off nurselabs.com. And they're free, free. Free. Make sure you guys go over there and check that out. I want to know who you are, where you're from, where you're at in your nursing journey. Let us know down in the comments. I'm going to give y'all 10 more seconds. I do my lives 3 times a week, Monday, Wednesday, Friday. It's at 5:30 Central Standard Time. And by that, in the United States, Texas time. All right, y'all, here we go. Here we go. Here we go. You're in Australia. Shout out to Australia. I have some friends that live in is it Brisbane? I always mess stuff up over there. You know what I'm saying? I got some friends I was deployed with in Afghanistan that are in Australia. So shout out to Australia. Here we go. Here we go. Here's our answer in 3, 2. And the answer is cover the insertion site with Vaseline gauze. If the client pulls the chest tube out of the chest, the nurse's first action should be to cover the insertion site with an occlusive dressing. Afterwards, the nurse should call the doctor, who will order a chest x-ray and possibly reinsert the chest tube. The chest tube may be reinserted at bedside, in the procedure room, or in a surgical suite. Healthcare providers often assist physicians in the insertion and removal of closed chest tube drainage systems. Slay, mama, slay. Wait, who we slaying in here? This happened to me. What, did you have a chest tube? You pull it out and they had to put it back in? I bet you it hurt too. Always have an emergency chest tube set at bedside. Yup. That, trach set, all that. In my defense, I haven't gotten to chest tube yet. That's okay. That's all right. Don't worry about that. You good? All right, y'all. Here we go. Question 24. Somebody from Mexico. Shout out to Mexico. Hey, I've been to Monterrey, and I've been to Reynosa. I've been there. But that's a long time ago, like before the cartel started wanting to, decapitate folks. So I'm just saying, shout out to y'all, LVN in California. Okay. Philippines. Hey, no lie. I'm going to try to move there one day. No lie. I think I might move to the Philippines. What you think? Here we go. Question 24. A client being treated with sodium warfarin has a protamine of 120 seconds. Which intervention would be most important to include in the nursing care plan? Assess for signs of abnormal bleeding, anticipate an increase in the Coumadin dosage, instruct the client regarding the drug therapy, or increase the frequency of neurological assessments. What are we thinking? Man, y'all all over the place, man. This makes me happy. We got A's, okay. We got some people from the Philippines. We got some people from Mexico. Got some people from Australia. Had some people from Nepal. I had somebody from Israel. Man, y'all Gucci out here. I appreciate y'all. I'm a social worker just watching. And so you're going to pick A. Shout out to you, social worker. I know some friends. I have some friends. Marshall. Is it Marshall? You're from Japan. You're not from Japan, Scorpio. Stop lying. Stop lying to me. You're probably from California. Yeah, that's what I thought. Here we go. Shout out to Maryland. 5 seconds, y'all. Yeah, look at you. Smiling. I know you fibbing over there. Here we go. Jessica from Chirac, I see you. What time is it in Japan? Well, Japan's like, 15 hours ahead of me. So I can't remember. Here we go. Here's our answer. Trinidad. Okay, here we go. Ireland. What's up, y'all? Here we go. 3, 2, and the answer is A. Assess for signs of abnormal bleeding. A normal protamine is 12 to 20 seconds. A protamine of 120 seconds indicates an extreme prolonged protamine and can result in spontaneous bleeding episodes. My man's gonna start bleeding out of his nose, out of his face, out of his eyeballs. It's gonna look like he have Ebola or some shit. Like, it's gonna be looking wild. Patients receiving treatment with warfarin should have close monitoring to ensure the safety and efficacy of the medication. Periodic blood test is the recommendation to assess the patient's prothrombin time and the INR. All right. I needed this in 6 years' time. Okay. Hey, I'll still be here. Hopefully. Get them some vitamin K. Yep. Hey, so protamine. What is it? What is the antidote for warfarin, and what is the antidote for heparin? Right. Those are two big things, and you need to know what your INR is. You need to know what it's going to look like. Spinach. Yeah, that's right. So you need to know what it looks like, right? You need to know when you're out of those ranges, like your INR, if it's above 2 or 3, right? What if somebody has a mitral valve, like a mechanical mitral valve, right? What is their INR going to look like? Protamine sulfate. There you go. Okay. Y'all smart. I appreciate y'all. Here we go. Question 25. Which selection would provide the most calcium for the client who is 4 months pregnant? Is it a granola bar, a muffin, a cup of yogurt, or a glass of fruit juice? What are we thinking? Shout out to all 400 plus of y'all. We are doing NCLEX questions. I got them off nurselabs.com. Go over there and check those out for yourself. Shout out to New Mexico. If you're new here, make sure you smash the like button, make sure you share, and make sure you follow. And we're going to do an Ask Me Anything after this. Okay? And Ask Me Anything after this. So hopefully we'll see how far we can get. Okay? I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, tell me what your profession is. Anthony, you're in Texas. Shout out to you, sir. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is a cup of yogurt, which is C. The food with the most calcium is the yogurt, which has approximately 400 milligrams of calcium. A growing baby needs a considerable amount of calcium to develop. If the mother does not consume enough calcium to sustain the needs of the developing baby, the body will take calcium from the bones, decreasing bone mass and putting the mother at risk for osteoporosis. Osteoporosis causes dramatic thinning of the bone, resulting in weak, brittle bones that can easily be broken. All right. How we thinking? PCA in Connecticut? You're in Connecticut. Hey, real quick commercial break. Make sure you guys participate. Give me all them likes. Love me. Damn it. Okay. Love me. All right. Give me all them likes. Give me all them gifts. Give them all to me, y'all. 600s. Hey, if you act a fool, I'm going to bang your ass. All right, done with the seriousness. Don't be rude, okay? I got these questions off nurselabs.com. 7-day NCLEX course. That's a course I created. $48. Make sure you guys go over there and check it out. You get it for a lifetime. And if you need coaching, go over there and check that link out in my bio. By the way, y'all, I failed my NCLEX 3 times. And none of y'all would have known that. None of y'all would have known that unless I told you. Straight up. Am I allowed to act a fool? Go ahead, Camille. Go ahead. You have permission to act a fool. All right. I failed my NCLEX 3 times, y'all. That's why I created that review, right? Because I never want anybody to feel how I felt, right? So some people are just like, yo, you failed so many times. Cool. But nobody would have ever known that. And it doesn't hinder my type of character and the type of nurse that I am. Because I'm a damn good nurse. I'm telling you that right now. All right. I had people tell me I would never let you be my nurse. No skin on my fucking back, bro. That's one less person I got to worry about. All right. So shout out to y'all. Be out there and be the best you. I'm trying to tell you, don't quit. Don't be one of those people. All right. Here we go. Question 26. A client with preeclampsia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates understanding of the possible side effects of mag sulfate? The nurse places a sign over the bed not to check blood pressure in the right arm. The nurse places a padded tongue blade at the bedside. Nurse inserts a Foley catheter. Nurse darkens the room. What are we thinking? Bro, how do I keep getting people in here that want to send me nudes? Like, do I look like the type of dude that wants your nudes? Don't answer that. All right? Don't answer that. I hate y'all if y'all answer that. All right, here we go. Here we go. What are we thinking? Shout out to all 580 of y'all. We're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys go over there and check that out, okay? Make sure you guys give me all them likes, those shares, and those follows. Is it Cheryl? Thank you for the follow. Anita, thank you for the follow. 10 seconds, y'all. 10 seconds. The website is nurselabs.com. None of these are good. Look, I didn't make them, okay? And look, Shannon and Shelby, thank you for the follow. Cassie, Lexi, and is it Crystal? Crystal, thank you for the follow. Here we go, y'all. Here we go. Here's our answer in 3, 2, and the answer is the nurse inserts a Foley catheter. The client receiving mag sulfate should have a Foley catheter in place, and hourly intake and output should be checked. Strict intake and output will be assessed throughout the mag sulfate infusion. Record urinary output at least every hour if Foley is in place. Otherwise, measure and record all voids. Urine output should be at least 30 mLs per hour while administering mag sulfate. If less, notify the healthcare provider of decreased urine output. So shout out to all y'all up in here that got the answer right. You know what I'm saying? So you guys got to think about what are the pharmacokinetics that happen when you give mag sulfate to a pregnant patient. Okay? You guys got to think about those things. All right? And make sure you read your rationales. Read those rationales because those will give you the answer. Those will give you the answer. All right. Especially if you don't know. Man, I wish I had a moderator right now. Never have I ever had so many people come in here and be like, hey, Kevin, I sent you pictures. Like, no, I wish. Right. Here we go. Here we go. Question 27. Question 27. A 6-year-old client is admitted to the unit with a hemoglobin of 6. Based off of that, y'all should already be thinking what we're about to do. I'll mod for you. I appreciate you. The physician has written an order to transfuse 2 units of whole blood. When discussing the treatment, the child's mother tells the nurse that she does not believe in having blood transfusions and that she will not allow her child to have the treatment. What nursing action is most appropriate? Ask the mother to leave while the blood transfusion is in progress. I don't know why I'm laughing at that. Lulu, you sent me pictures. Stop it. Encourage the mother to reconsider. Explain the consequences without treatment. Notify the physician of the mother's refusal. Automatic C. Notify the physician. So here, think about it. Keyword in the sentence, right? What is the most appropriate? Keyword. Just tell her, hey, just close your eyes. Tell her to turn around and be like, no, I'm not going to say what I was going to say next because I don't need nobody to be like, do you know what he said on TikTok? Banned. Explain, educate. Okay. All right. There was a question we had similar like this before. Send me pictures of dogs. Do you need a mod for you? No, I don't. I actually have a few mods. They're just not here. And that's actually the first time I've ever had that happen. So 10 seconds, y'all. If you're new here, we're doing NCLEX questions. I got them off nurselabs.com. Make sure you guys go over there and check that out. I want to know who you are, where you're from, where you're at in your nursing journey. Precious, thank you for the flower. Somebody else gave me a flower too. Who gave me those flowers earlier so I can give you a shout out? Here we go. You got to respect the culture. Here we go, y'all. Here we go. Here's our answer. In 3, 2, most likely Jehovah's Witness. Most likely, right? D, notify the physician of the mother's refusal, right? If the client's mother refuses the blood transfusion, the doctor should be notified. Because the client is a minor, the court might order treatment. Appropriate management of such patient entails understanding of ethical and legal issues involved, providing meticulous medical management, use of, prohemostatic agents, essential interventions and techniques to reduce blood loss and hence reduce the risk of subsequent need for blood transfusion. Y'all, in Australia, we do none of this. Well, that's crazy. That's crazy. So I'll give you guys a prime example. I've seen this happen before where they were like, hey, I refuse to do this. And I've literally seen the charge nurse go all the way up to the house supervisor. They get a hold of the administrators, and then they get a court order to do a blood transfusion for a 9-year-old child because the parents refused to do it to save their life. Right? Hey, if you guys didn't know this, anybody from Texas, everybody know about Salinas, right? So she was Jehovah's Witness, and they didn't do a blood transfusion for her, and she died. So sorry to bring down the room, but there you go. All right, here we go. Question 28. Yes way. Here we go. Another great resource. Yeah, Mark Klimek lectures on YouTube, if they are up there, because they get pulled down all the time. Just letting y'all know that right now. Question 28. A client is admitted to the unit 2 hours after an explosion causes burns to the face. The nurse would be most concerned with the client developing which of the following: hypovolemia, laryngeal edema, hypernatremia, or hyperkalemia. Scream it in the chat. Scream this answer. Scream it. In my mind, I'm like, this is so easy. However, everybody is at different stages in their nursing journey, right? So if you don't know it, that's okay. And if you're not a nurse, I really don't expect for you to know it unless you're a doctor or something like that, or respiratory RTs. You better know this. And stop playing games up in here. You know what I'm saying? All right. 10 seconds, y'all. Hey, if you're new here, we're doing NCLEX questions, nursing questions, okay? Got them off nurselabs.com. Check them out. Go to the website. Look at it, all right? I want to know who you are, where you're from, where you're at in your nursing journey. All right, here we go. Y'all. Here we go. In 3, 2. And the answer is B, laryngeal edema. I'm not even going to lie to you. If this answer was not that, I would have been like, all right, y'all, that's it for the night. The nurse should be most concerned with laryngeal edema because of the area of burn. For burns classified as severe, which is greater than 20%, fluid resuscitation should be initiated to maintain urine output. One commonly used fluid resuscitation formula is the Parkland formula. The total amount of fluid to be given during the initial 24 hours equals 4 mLs of lactated ringers times the patient's weight in kilograms times the percent of the total body total burn surface area. All right, 44-year RN BSN, Lord have mercy. My sister is 44. First year pre-med, shout out to you. Shout out to you. Hey, so anybody that has a burn to the face, airway, secure that airway. Anybody that gets a burn to the face, or if they have burns more than 20%. So if they got 20% of their legs are burned, you better intubate them because their body is going to naturally start to swell up, even though their legs are the only things that are burned. Okay. So really appreciate your help. You're welcome. Third year, New Zealand, man, y'all all over the place. Going to take the NGN in December. Shout out to you. Is it RG? Shout out to you. Here we go. Question 29. The nurse is evaluating nutritional outcomes for a client with anorexia nervosa. Which data best indicates that the plan of care is effective? The client selects a balanced diet from the menu. Client's hemoglobin and hematocrit improve. The client's tissue turgor improves, or the client gains weight. What are we thinking? Questions. What are we thinking? I'm gonna give y'all 20 seconds. Got these questions off nurselabs.com. Nurselabs.com. That's where I got them. I want to know who you are, where you're from, where you are at in your nursing journey. Let me know. I've been a nurse for 3.5 years. I've been in the Navy for 16 years. In case anybody cared. I doubt y'all care. But been in the Navy 16 years. I've been on 2 deployments. Went to Guantanamo Bay, Cuba, and I've been to Afghanistan. I've been a surgical tech instructor. Was one for about 3.5 years. I'm actually a trauma nurse instructor now. So your boy loves teaching. I love being here. I love being on TikTok doing this. I was in the Navy. Look at you. Tell you the answer. First of all, I won't tell you nothing. I'll give you the answer. The fuck do you mean? Don't rush me. I'll ban you too. Here we go. Here's our answer. In 3, 2, and the answer is D. The client gains weight. All right. The client with anorexia shows the most improvement by weight gain. Expect weight gain to be about 1 pound per week to see the effectiveness of the treatment regimen. Establish a minimum weight gain and daily nutritional requirements. Malnutrition is a mood altering condition leading to depression and agitation and affecting cognitive function and decision making. Improved nutritional status enhances thinking ability, allowing an initiation of psychological work. My bad. There we go. Hey, this is why it's really important when you do NCLEX questions or any questions that matter. Read the rationales. You have to read the rationales. What are you telling me next for? Like, I didn't realize that we were on y'all's time. Oh, we're on my fucking time. What do you mean, guy? Here we go. Question number 30. All right. Shout out to y'all. Hey, if y'all are new here, hey, if you get sassy with me in the chat, I get sassy with you in the chat. Don't play with me. All right. Here we go. Question 30. I was in Gitmo from 2008 to 2009. The client is admitted following repair of a fractured tibia and cast application. Which nursing assessment should be reported to the doctor? Pain beneath the cast, warm toes, pedal pulses weak and rapid, or paresthesia of the toes. What are we thinking? I worked in trauma. It's insane. Facts. Y'all better leave Kevin alone. Hey, you better let him know. I ain't the one to play with. Hey, but I love all 600 plus of y'all. Straight up. Paresthesia of the toes. Okay. Paresthesia of the toes. All right. If you guys are new here, we're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys like, share, and follow. All right. Too easy. I'll wait, though. Okay, trauma surgeon. I see you out there. I like to see doctors come in here and they'll be like, I know the answer. Then they get it wrong. That's no shade, though. I'm just messing. But I think it's funny. I'll be like, hey, man, sometimes you can't win them all. Can't win them all. Here we go, y'all. Here we go. Here we go. Here's our answer in 3, 2, and the answer is D, paresthesia of the toes. Paresthesia is not normal, and might indicate compartment syndrome. Acute compartment syndrome occurs when there is an increased pressure within a closed osteofascial compartment, resulting in impaired local circulation. Acute compartment syndrome is considered a surgical emergency since without proper treatment, it can lead to ischemia and eventually necrosis. So shout out to everybody. Shout out to the trauma surgeon that was up in here that got it right. So shout out to you. Wait, somebody just said they passed NCLEX. Who said that? Let's fucking go. Tammy, you passed your NCLEX yesterday. That's what I'm talking about. All right, all 700 of y'all need to flood this chat right now and tell Tammy congratulations. Tell her welcome to the shit show, the greatest shit show on earth of being a nurse. All right. It was May 2008 to December 2009. But hey, everybody congratulate her because, hey, passing that exam is not easy. I don't give a fuck what none of y'all say because it's not easy. All right. So just letting y'all know, give her some love. Congratulations, Tammy. Welcome. All right. Physiological adaptation, y'all. That's the third largest section on NCLEX. All right. Hey, and y'all are about to be sad and disappointed because, ladies and gentlemen, that is a wrap. I appreciate y'all participating. I appreciate all the love. I really do love all y'all. Look, hey, we reached Australia, Nepal, all them people out there, Israel. I appreciate y'all. I appreciate everybody that came here. I banned like 5 or 6 people and I enjoyed it. I'm not sorry and I'm petty. Over 9,000. Swear to God. I got these questions off nurselabs.com. You guys can go over there and check that out. Hey, we're gonna do an Ask Me Anything after this. We're gonna do an Ask Me Anything after this. If you guys want to ask me questions, I'm cool with that. If you need NCLEX coaching one-on-one, you can book yourself a call, 15 minutes. We can talk about some stuff and we can see we can go from there. Also, 7-day NCLEX course. It's in its pre-launch phase. It's $48. You get it for a lifetime. It won't be in its pre-launch phase forever. It'll eventually go away. So go over there and check that out for yourself. You're going to graduate in 3 months, 6 months to a year. Perfect for you. If you're taking your NCLEX tomorrow, probably not. Okay. All right. So what I'm going to do is I'm going to turn this damn camera around so people can see me. What up, people? What up? We got 500 people up in here. We got 19,000 likes. I appreciate every single one of y'all. How y'all doing? Of course, I'm Kevin. I go by the Boot Nurse. Hey, make sure you guys go over there and check me out on YouTube. All of these TikTok lives that I do will go up on YouTube as well. Okay? Make sure you guys like. Make sure you guys share. Make sure you guys follow. So, yeah, Stephanie said, what's up, Steph? Gigi says, hello. How are you? I'm taking mental health. Any advice? Mental health is all about good therapeutic communication skills. Can you give me any tips on how to study for fundamentals? I'm struggling with that class. Get into a group. Get into a small group of people, right? You, 3 other people, split it up 25%, right? Split it up 25%. You do 25% of the work. You reap 100% of the benefits if everybody does what they're supposed to do, okay? What about farm? With farm, you want to know family name and suffixes, right? So cardiac meds. What falls under the cardiac family, right? You got your A's, your B's, your C's, your D's, right? You got to know what their pharmacokinetics are. You need to understand the safety implications of when you give those medications, okay? Safety implications, all right? What is your YouTube? My YouTube is The Boot Nurse. If you go to my link in my bio, it'll take you to a link tree. All that stuff is laid out for you. I went to school for respiratory therapy, but I still love to watch things on nursing. Shout out to you, Jody. I appreciate you being here. I really do. Hold on a second. All right, here we go. How often do you go live? I go live Monday, Wednesdays, and Fridays at 5:30. You must have been my relief in Gitmo, or were you a corpsman down in the camps? So I was a corpsman and I was at the hospital. So, but I went to and from like Camp America, and I hung out at the JTC or the Joint Troopers Clinic a lot. So that's where I was at. I was helping I was a Quad Zero corpsman then, and I was helping out PMTs. What about micro? What advice can I give you? Oh, micro? Hey, Khan Academy on YouTube. Too easy. Thank you. You're welcome. HESI tips. Study that Elsevier book. What was the most challenging subject? For me, it was pharmacology and maternity. What about health assessments? With health assessments, find you a guinea pig and start going down the assessments. Literally hand your hands to people, right? That's the best way to do health assessment. Okay. Okay. Not the camps. No, I went to the camps. I just started general nursing in September. What is your YouTube name? The Boot Nurse. That's what it is. Can you help me with HESIs for peds and maternity? So for what time do you come live? So, hey, so my lives are 5:30 Monday, Wednesdays, and Fridays, right? Central Standard Time here in the United States. All right. So just think of Texas, and that's the time that we're on. Okay. For HESIs, mostly it's the Elsevier book, because that's where they get all the questions from. For real. Like, that's where they get all the questions from. So what other questions you guys got? Did you just did my second exam for farm? Okay. Is it Kenna? Do you own any figs? First of all, no. I do not fall into the trend of figs. However, I have Rothware. I like Rothware. That's why I have. What state did you take your NCLEX in? In Texas. Texas, Zoe. That's where I took it. What else? What other questions you guys got? I'm pretty sure I'm supposed to do something today, and I'm just not sure what it is. Like, I don't know if I have a coaching call or something like that. I'm about to figure my life out, because if I'm late, she's going to be mad at me. Struggling with EKGs. Hey, so here's the big, so if you're struggling, if you're studying for EKGs, if you're on NCLEX, they're the ones that, here are the ones that you really need to know. Asystole, VTAC, VFib, A-flutter, AFib, and maybe torsades, right? But the rest, the one, you need to understand what everybody else knows. Like, I don't expect for you to go in there and remember, like, second degree, type 2, second degree AV, I don't expect for you to know all those, right? Can you repeat what you said about the Elsevier book? I was saying that if you're trying to study for your HESI, that's where they get all the answers from, right? And then, of course, Khan Academy, right? I want to be a nurse so bad, but I'm bad at math. How do I overcome my math? Study. And the thing about it, the biggest thing about math is just like, it's simple math, like it's conversions. Tips for med-surg, like you talk about, like the class, get into a study group. You will always hear me tell you to get into a study group when it comes to doing, when it comes to your classes and studying for your exams. You, 3 other people, 25% of the work, 100% of the benefit. All right. And when I was in school, the girls were so scared. They were like, oh, we're cheating. How the fuck are we cheating when we're like looking in the book together? Like, stop playing with me. Don't be scared of that either. I didn't have any EKGs on my exam. That's cool. But you may not have like the actual strip, but they may actually talk about like, hey, you have a patient who is in ventricular fibrillation. What is the first thing that the nurse should do? Think about that. So no to figs. What do you use? I have Rothware. That's what I have. All you practicing nurses and nurses, thank you for your service. Shout out to all the nurses out here working. Semester 7, everyone is saying that it's the hardest. Would you say the same thing? I don't know what semester 7 is. Like, I was in an accelerator program, so I don't know if that's your last one or anything like that. But the hardest part is, I think, is that you're like right at the end of the tunnel, and you're just like, I kind of want to quit, but I can't. You got to kind of push through. I want to pass the NCLEX. How about we change up our verbiage, and then instead of saying you want to pass the NCLEX, say I will pass the NCLEX. Put it out into the universe. Speak it, and it shall be so. Okay. All right. What are your study tips for fundamentals? So the biggest thing about fundamentals is that fundamentals is the basics. I don't expect for you to know everything, but you're going to learn it. Right. And so they have really good programs that are out there. But of course, YouTube, like no lie. All right. Hold on. Tips for creating a care plan for clinicals. Brittany, if you want a good care plan, go to nurselabs.com. And they have the nursing diagnosis. They come up with a care plan, all that stuff. For VFib, you defib. That's right. What do you enjoy most about being a nurse? 2 things. Positive patient outcome and teaching nursing students and nursing graduates the way that I do here on TikTok. Or just in general, even in passing. Like, I'm telling you, I'll see a group of nursing students, and it takes every fiber in my being to not go over there and be like, hey, guys, what are you guys doing? What are you guys learning about? What do you guys want to learn? Okay, cool. Literally, I've done that at work. Community health, I think. I want to be a nurse, but the NCLEX is my big challenge. Okay, once again, like I said, we change up our verbiage. Let me see. Nice. Why don't you like Fig? Because I don't kind of like. It's kind of like hey, why don't you like an iPhone? Because I don't. Because I have an Android. Do you tutor? I do tutor. You can go if you need tutoring or if you want one-on-one help. Go to my bio. You'll see the link where it says NCLEX one-on-one tutoring or NCLEX coaching and mentoring. And yeah, that'll be there. What's a good study program you recommend for NCLEX? Well, Zoe, it all just depends on where you are at in your journey for NCLEX. But because first one I'll always say is mine, which is the 7-day NCLEX course. You can check that out. The link is in the bio. $48, right? Or you have Mark Klimick, you have Hurst, you have Kaplan, you have Remar, you have Archer, you have UWorld, you have NCLEX High Yield, you have Simple Nursing, you have nurse.com. They have so many that are out there. It all just depends on you and what you want. I will always tell people to get a full package where they have content and they also have what's the word I'm looking for? Like Q&A. I will always recommend that. Always. Let me see what else we got. I was good at math. I became a nurse 30 years ago. I mean, the thing about it is like, you don't have to be spectacular at math. Like you really, really don't. Right. You just need to understand the conversions. What are pathophysiology tips? Man, I don't even know. Like pathophysiology was by far my most favorite class. And so I literally was in that book, but I learned it all out of the book. And I really can't give you a tip because that was by far my favorite class. Thank you. Hold on. I'm trying to scroll. What type of nurse are you? I'm an OR nurse right now. Kevin's trauma. No, I'm not trauma, Anita. Not a trauma. So in 7-day practicing will help pass NCLEX. So the whole thing about 7 days is most normal live reviews that people go to, they're 3 days long. So if you go to one that's like Kaplan or Hurst or anything like that, they cram all this information into your brain, right? Within like over a weekend. So what I did is when I started studying for my NCLEX a long time ago in 2018, that I realized that cramming all that is not conducive for a lot of people. So what I did is I started to spread it out to see what would it be if I could take 2 to 3 hours out of my day to really focus on this one specific area, then go to the next area, then go to the next area. So that's where the 7 days comes from. Within 7 days, you will understand the concepts and have the foundation or the ground laid for you so you can better progress on towards passing that exam. Okay. Do you just teach NCLEX? So I can, yes, Nexus Nurse is another one too, Anita. I can teach anything in regards to nursing, but my passion is teaching NCLEX specifically. $48 will prepare me for 7 days. Yeah, I already answered that question. Remar is very good. Somebody was in my live on Wednesday and said that they didn't like Remar at all, but it's all based off of you. UWorld and Hurst did it for me. Passed on the first time. So when I eventually did it, it was Mark Klimick and it was Kaplan. You know, some people use Archer and they use Hurst. Some people used UWorld and use Hurst. Some people use this and use that. I mean, you can use a combination, but my recommendation, do not use more than 2 because you're going to start having all these different programs telling you different things and they're going to contradict themselves. And then you're going to be like, what the hell do I do? Right? Let me see. Oh my God, an OR nurse. How do you like it? So I was a surgical tech for 13 years. So I was already very used to being in the operating room. So honestly, it was just it was a very easy transition to being familiar with the operating room and the operating room setting. But when I worked in the ICU as a brand, as a nurse, I worked in a burn ICU, I worked in neuro, and then I worked in a medical ICU. So I worked in all 3 of those. And I did that for over a year, and that was during the second wave of COVID, and then I got burnt out and I didn't want to be a part of that no more. So then I left, and then I went to the PACU, and then I went to the OR. PACU is great. If you've never been there, I would highly recommend it. Yes, you can go there as a new nurse as well. I may be naive, but could you describe the difference between the ER and the OR? So the ER, which is the emergency room, or the ED, which is the emergency department, life, limb, eyesight. Those are the patients that specifically go there, trauma patients, sick patients coming through, so on and so forth. OR is operating room nurses or perioperative nurses that work specifically in the surgical services. So the operating room, they can work in PACU and they can work in pre-op. So those are like the big 3, or, like if they're in cath lab and stuff like that, those kind of go like interchangeable, right? But OR is a circulating nurse or a scrub nurse or a first assist, which means you get to be up at the bedside helping and assisting a surgeon during a surgical procedure. Okay. Kenna, that's what it is. I love Mark. That's what I use, and I love how he explained things. So for me, like I said, I was an instructor for a long time before I saw Mark Klimick, and he made it very easy for me to understand. And I've adopted his whole method of how he teaches, making things extremely relevant. So I pull things from all the things that I've learned and I give it to other people. Have you heard UWorld is really good? I used UWorld. I didn't like UWorld, me personally. CVOR RN here. I thought about going to CVOR, but then nah, I didn't want to do it. 21 years nursing, starting OR next week. Can't wait. Shout out to you, Alicia. Toughest part of an accelerator program. I have a program I am looking at, but that is 16 months. So my program that I went to, Carson, was 18 months. Another one here in Texas is UT in Arlington that has an accelerated BSN program that is 15 months. A scrub nurse is essentially, I think I already answered that, but essentially a scrub nurse, they can actually, be up at the field helping the doctor during the procedure, right? Stryker says, I'm 50 years old, 8-year EMT, 3 in the ED currently in my second and fourth semester of a master's program. Glad I found you. Stryker, sir, I'm glad that you showed up and you're here. Thank you for explaining the difference. You're welcome. I think I want to use simple nursing, and I heard Mark Klimick is really good. Mark Klimick is great. So here's the thing. Those reviews that Mark Klimick did, the audios or where if you find them on YouTube, he did those like in 2008, 2009, 2010, something like that. However, since things moves at a snail pace, honestly, it's still about 90 to 95% accurate. There's just a couple of nuances in there that are just very different, right? So yes, also known as a surgical tech. What do you mean? A scrub nurse is also known as a surgical tech? Because a surgical tech is just a surgical tech. Now, if you're a scrub nurse, you're a nurse who has, the certification from the National the National Board of Surgical Techs and Surgical Assistants. I used to be a surgical tech instructor, and I used to actually teach the surgical tech. We had a CST prep course, and I actually used to teach that as well when I was active duty working at that school. Currently in my 11th month BSN program. Send prayers. Just started med-surg, and it's tough. Med-surg is tough. So like I was saying, KT, but you weren't here. Get into a small group of people, 3 other people, split the work up 25%. So, if you're going to, if it's you and 4 people and you have 16 chapters, each person takes, 4 chapters, you do them. And then at the end, put them together. And then you did 25% of the work, but you reaped 100% of those benefits, right? What do you think was the toughest part of an accelerated program? Time management. That was extremely hard. Time management. Had a clinical in NICU yesterday, and I've never felt more confident of where I want to work one day. Well, Bailey, go there. Do not pass go. Do not collect $200. Take that ass to the NICU, all right? Take it there. I worked on a telefloor ICU. Always wanted to see if I would like the OR, but worried I would get bored. So, depending on the OR that you work in, it can get very, not stagnant, but you can get very bored depending on what specialty that you work in. Now, if you work in like neuro, or if you work in cardiovascular, or if you work in ortho, then, especially ortho, you're going to be all over the place, right? Now, if you're like in general surgery or GYN, those are real like slow pace, unless they go open and then shit starts getting real fucking real, then the thought process changes at that point, right? Just started my prereqs for nursing. Is it Fabian? Is it Fabian or Fabian? Fabian, give me a 1, and Fabian if it's 2. Let me know. All right. Shout out to all 100 of y'all in here rocking with me. Y'all got me to 21,000 likes, so I appreciate y'all. Fabian, got you. I got you. My name is Kevin. I've been a nurse for 3.5 years, right? Been in the Navy for 16 years. So it's almost time for me to go out the door. That's where I'm trying to go. Advice for A&P1. Honestly, all A&P is memorizations. So I would definitely look at Khan Academy. I used Khan Academy on YouTube for damn near almost everything when I was in my prereqs. Everything. All right. Lily says, hi, I'm getting my BSN now, but I'm really interested in sonography. Is that possible as an RN? Yes. Let me tell you something. You can do You can literally work in so many different specialties as a nurse, as a registered nurse and an LPN, a licensed practical nurse. It's unbelievable. Like you could be a nurse and work in radiology, right? I actually had a few nurses that said that, hey, I worked in here and I do this, that, and the third within radiology, and it's very much possible. So if that's where you want to go and that's where you want to specialize, you can make it happen for sure. Ash says, thank you. Khan Academy is amazing. Lisa, they really are. I'm struggling with mental health class. Any advice? So, Kenna, the biggest thing about mental health is therapeutic communication. That's what it is. It's all about what they say to you and how you respond, right? So I don't know why I'm here. This is so stupid. You took my stuff. I want it back. So instead of you saying like, well, that's too fucking bad, you're not getting it back, you say, hey, I understand how you're feeling. It's being kept safe right now. Stuff like that. That is all what psych is. It's all about good therapeutic communication skills. What is it? How long did it take you to finish your program? My bachelor's program, it was 18 months, the accelerator program. How would you go about working in sonography after nursing school? I haven't seen much on how to. So I would recommend going to Nurse Lily, specifically for Lily, nurse.org. They have a resources tab, and then they have a certification tab. Click that tab and then scroll down to radiology nurse, right? And then if you can't find it, this is no shade and this is not to insult your intelligence, but Google that shit. GTS it. Okay. So I don't know much about it. I just know that when I've seen it, and I didn't really do too much research on it, but I would say start there. So that can give you, a little bit more direction. Okay. Hey, if you guys are new here, welcome. My name is Kevin. I am a nurse. We went over nursing type of questions earlier. If you guys want to be a part of that, make sure you guys like, share, and of course follow. So, when I do those, as well as share it to somebody else. You never know who's going to need it and when they're going to need it. And, I'm all about being beneficial. Is your wife a nurse? No, she is not. And I don't have a wife. So don't got one of those. It says, I have my last exam in my RN program on Monday. Shout out to you. So on Monday, go in there rocking. So that means you about to graduate. That means you finna graduate if you're taking that last exam, right? So graduate, right? Start studying for that NCLEX, okay? Speaking of the NCLEX, in my program, I literally, right before I got on here, was editing a video. And it is my new generation NCLEX review, right? And it is right now, it's about at like 3.5 hours. Y'all hear me? It's about at 3.5 hours. So I'm going to chop it up and I'm going to put it in 30-minute videos, because who the hell wants to sit there for 3 hours? Nobody. So I don't want to sit there, right? But for y'all, I'm splitting it up in 30-minute increments. Okay. So if you bought the 7-day NCLEX course for $48, y'all, if you've bought it, it's going to be up next week. Okay. Going to edit it some more, then it's going to go up there. All right. LOL. For some reason, I feel like so much more is involved with mental health. When it comes to answering the questions, not so much. Yes, I am here. Hypothetically. Okay, here we go, Nate, with the hypothetics. Hypothetically, do you know if I was to get my nursing license in Washington, I can move to California? So you can get your nursing license anywhere in the United States. However, if they're not a part of the NLC, which is the Nurses Licensure Compact, then you have to apply for that state's Board of Nursing license. But you don't have to take a test or anything like that. I'll like open-ended questions I need to work on. Yep, exactly. What exactly would I have to do for that? So if you live in Washington and you want to go work in California, go to California's Board of Nursing and apply to get their license there. That easy. Does anyone have tips for ATI exit exam? Who got tips for ATI? To all my nurse friends, respiratory 25 years, my friends with the entire care team. Shout out to you. Mallory. Yep. I remember. If I said it wrong, let me know, but I'm pretty sure it's Mallory. I'm pretty sure. Do you think new grads should start in med-surg? I think new grads can go wherever the fuck they want. If you want to go to ICU, go. You want to go to OR, go. You want to go to med-surg, go. You want to go to tele, go. Right? You are not restricted to med surg. Do I believe that you should go there? No. Go to where you want. I don't care what nobody says. I don't care what nobody tells you. Gone are the days where you have to pay your dues. You can't, hey, beggars can't be choosers. You can't be out here saying we need nurses, for fucking COVID, but you tell me I got to go to med surg. What kind of shit, what kind of sense does that make? Like, put me where I want to go. Do not pass go. Put my ass in ICU because that's where I wanted to go and that's where I went. So if that's where you want to go, apply for it. But if you don't know where to go, there's nothing wrong with med surg. If you want to go to med surg, there's nothing wrong with that. Med surg is a specialty, y'all. You can get a certificate in med surg. Don't shit on it. But if it's not for you, that's okay. You can go to the ER. You can go to the cath lab. You can do those things. I want to go to the OR. Chris, go to the OR then. Because you can do it. They have residency programs for that exact reason, y'all. I'm going to hang out for about another 10 minutes, okay? Is there a department you personally would never work? I would never work in psych, and I will never work in labor and delivery. I'm going to tell you why. I'm going to give you a quick little story. Was in labor and delivery as a student, walked into a room to do an assessment for somebody. Woman was pregnant, in labor. There's 5 dudes that are standing there, and I'm just like, oh, they must be like relatives. And then I found out that those are possible baby daddies. I walked into a Maury studio, and I was just like, wow, I'm uncomfortable. Time to leave. And I was like, yeah, I don't want to do that no more. Would I have to take retake the NCLEX after becoming an ASN and pass it? No, because the same NCLEX that you take as an associate's degree nurse is the same you take as a bachelor's degree nurse. All right. Yes, hate the med surg rhetoric, right? Tips for NCLEX, Kevin. Study for it. I'll give you an answer for that. Did you do a residency program? I did a residency program. Day before the NCLEX tips. Oh, I actually got a video. Go to my YouTube and look at my video, or go to my bio and look where it says my 5 tips the day before you take NCLEX. Go check it out. Erica, I answered your question. Erica, why are you spamming me? You finna get a 600. Y'all better let her know what a 600 is. At least they all have to be present. Okay, thank you. I don't know what happened. I don't know what I missed. Shout out to all 100 plus of y'all that are in here. Hey, if you guys are new here, welcome. My name is Kevin. I'm a nurse. We do NCLEX questions every Monday, Wednesday, and Friday. So make sure you guys make sure you guys share, and make sure you guys follow. That's what we do. And if anybody needs help with NCLEX, you need a review, but you don't graduate for like another 3 months, 6 months, a year. I got a review that I created. It's in its pre-launch phase. Right. I'm putting some heavy hitter stuff that's going up in the next couple of weeks, y'all. Y'all got to be ready for that. All right. Say, what questions do you guys have? All right. What questions do you guys have? I want to know who you are, where you're from, where you're at in your nursing journey. If you're a nurse, I've had some doctors in here, all kinds of stuff. In my end, I wasn't posting. I wasn't posting. Oh, I was like, I don't know what's going on, Erica. It literally had like the whole thing was you. I was like, what's up with that? What was your question? Your question was about associate's degree nursing, and I think I answered it. I need an advanced patho tutor. Mindset for second attempt after failing the first. Well, Anita, I failed 3 times. So the one thing I'm going to tell you is grab your breakdown. When you grab your breakdown, look at it. See where you had below, near. Start with the ones that you have the most difficulty with, right? And then as you start with those ones that are difficult, you still have to incorporate your NCLEX style questions, answers, and you need to read and review your questions after you finish. That just like how we do with our questions when I do these live, that's exactly how you study every single time. That's exactly how you study. All right. I hate psych, but work in labor and delivery. Look, you won't see me work in psych. I'll be ready to fight. I can't be doing all that. Right. And then here's another thing. Where's Anita? Where's Anita? Like we hear. Anita, you see this piece of paper right here? You see that piece of paper right there? That's my NCLEX breakdown, right? That is one of the 3 that I have. Okay. That's one of the 3. And I keep that up there every single time to not forget the position that I used to be in. Never. New York only needs nursing credits. What do you mean? What do you mean, Erica? What'd I miss? So I keep that up there every single time, right? Because in the end, the only person that's going to stop you from becoming a nurse is you. Everything is your fault. Like you can't even see this, right? But there's this little saying that's right there, right there with that big E, it says everything is your fault. And I'm saying that to myself. And I'll tell every single one of y'all that are in here that if you're failing something or if you don't understand it, it's your fault. But my follow-up question is, how are you going to fix it? How are you going to fix it? And then some people are in here saying, hey, I need help. Okay, you need help. Oh, hey, some people are just like, I need a tutor. Or some people are like, oh, I'm going to go use these additional resources. Cool. And then some people are like, oh, well, it really wasn't my fault. I had no control over it. And you're right. There are things that are out of y'all's control. And I get it. But then my follow-up to that is, and dramatic pause. How are you going to fix it? All right. That's what I tell people every single time. I tell them in this live and I tell them in my one-on-one coaching, because nobody cares about how you feel. Right. Your feelings are valid. I don't disregard them. Right. But no one cares. Right. You have to put the work in. Legit. Like, you have to put the work in. So when people come up to me and be like, oh my God, I failed, Kevin, what do I do? And then I'm just like, you have to audit yourself. Like, legit. Like, you legit have to audit yourself, because ain't nobody taking that test but you. It's just you and a computer screen. So you're going to let the computer screen beat you? That computer screen is stationary. They got dust and shit on them. They don't get to go out here and live their best life. You need to do what you need to do in order for you to be successful. All right. And that's not just for you, Anita, but that's for all 100 people that are in here to listen to me run my mouth and be motivational. Okay. So shout out to everybody that's in here listening to me run my mouth. Failed my first bio exam in undergrad, having second thoughts of getting my BSN, studying harder. Hey, this is what I tell people. If you fail, the next thing that you do will really tell me what type of person that you are. So you're either going to be like, oh, fuck it, I'm not going to do it. Or you're just going to be like, man, fuck. All right, well, man, let me figure out what's going on. Because first thing I'm about to go ask the teacher, be like, hey, what did I do? Hey, blah, blah, blah. What, help. Like, what do I need? Like, what do I need to do to better improve myself? Right? Like, what do you need? Only you know that. I don't know that. I don't know you personally. Right? Just like when I have some people come up to me and I'm just like, hey, so what is the reason why you think you failed your exam? And they're just like, oh, well, I guess I didn't study. And then I turn around and I say to them, I was just like, no, there's no guess. There's no guessing here, like, at all. Like, you didn't study. Like, open your mouth and say that you didn't study. Like, you have to come to terms and come to the reality that if you don't put in the fucking work, you won't get the results. You won't do it. I'm trying to tell you right now. Let me see what y'all are talking about. Y'all are saying preach, you're motivated. I appreciate it, man. I appreciate it. Hey, I'm thinking about doing motivational speaking, but for my crew, my tribe, nursing students, nursing graduates, nurses, right? I'm trying to be / comedic and motivating, kind of like Nurse Blake. You know what I'm saying? I'm trying to be that dude's friend, but he ain't hit me up. You know what I'm saying? So hey, one day, right? One day, learned that the hard way. Worst score I got was a 70. Now I'm in the high 90s because I let it fight. That's what I'm talking about. I feel like I'm trying to study too many different ways, and I don't know which way is best. So Sarah, I'm going to answer that. I'm going to answer that question here in a second. I'm that student. I don't mind asking. I will stay until today is my 60. Okay. Stay until you get the answer. So Sarah, specifically for you. So I'm going to ask you this question. What type of learner are you? Right? Once you figure out what type of learner that you are, you will be able to study more effectively. So are you a read-write? Are you a person that gets a pen, your notebook, you're looking in the book and you're writing, right? And you're writing word for word because you seeing it, you writing it and keeping that memorization, like, is that how you learn? Are you an auditory? Like, do you like listening to music or podcasts, audiobooks? Like, how do you best retain that information, right? Are you a visual learner? Right? Like, you have to be able to see it. Like, you need animations. You need PowerPoints. You need somebody to read it for you. Like, stuff like that. Are you a kinesthetic learner? Like, are you a hands-on? By the way, majority of people are visual And then right under that is kinesthetic, right? So it depends on what type of learner that you are. Once you figure out what type of learner that you are, you will better be able to retain information. Okay, I'll give you an example. When I was studying for NCLEX, I listened to Mark Klimick to and from work everywhere. When I wasn't in front of this computer, I was listening to Mark Klimick. I didn't care what it was, in my car, in the shower, while I was mowing the lawn, when I was cleaning, whatever, right? And so it got to the point where I fell asleep one day and all I could hear was, like heparin, like he said, heparin, protamine, coumadin, K. Or he said, who can sterilize my bowel? Neo can. And I could hear it like it was a rap song. It was wild, right? So you have to figure out what type of learner that you are. Once you understand what type of learner that you are, you will better be able to retain information. I literally just said that same thing 3 times. Okay? I said the same thing 3 times. And then once you find your rhythm, you will always find that it's effective and you will always use that study technique for yourself. Doesn't matter if you're getting your bachelor, if you're getting your associates, your bachelor's, your master's, doctorate, whatever. Same thing all the time. How do I find it? So I'm asking you. So you find it by asking yourself. Like, do you like listen? Okay, here's an example. Do you like listening to podcasts, Sarah? This question is specifically for you. GMAX said, I used to record myself and replay in my car or before bed. Okay, Sarah, so you like to listen to podcasts or you like to listen to music. So, thought process, find a good NCLEX or a nursing podcast for the specific things that you need. So like if you're in nursing school and you really, really, really need to understand pathophysiology, find you a pathophysiology podcast or one on YouTube and let it stream itself through your Bluetooth in your car when you're going to and from work or to and from school, or when you're supposed to be studying, but you're scrolling on TikTok asking about fucking Taylor Swift and Travis Kelce. Instead of doing that, listen to those audios, right? That's one way to do it. Now, if you're visual, I will always recommend YouTube. It is the second largest search engine on the planet. I would say go to TikTok, but TikTok is very fast information. It gives you a little bit and expects for you to go do a little bit more research. YouTube, the long game. You get the long videos. You get more of the understanding. Okay? Kinesthetic. If you're in nursing school, especially if you're trying to do like health assessment, start touching people with respect. Okay? Don't be trying to go out there and just start touching random people like you see a nice hot guy or you see a nice attractive female. You're going to be like, hey, can I do a head to toe assessment on you? Yo, that's a Riz right there, yo. Like, is that what the kids are saying? Like, we rizzing out here? Hey, if anybody does that, hey, just give me credit. Come into the next live and tell me, hey, yo, I rizzed somebody. I told them I wanted to do a head and toe assessment. And they're just like, yeah, you know what I'm saying? That's what I'm talking about. But, hey, if you're in school right now and you're trying to do head to toe assessment, grab people, volunteers, and start going down the list, looking for the things that are standing out. What are the things that are unexpected? But then, of course, what are the things that you should expect when I'm checking for Perla? What are some things I'm checking for Perla? Sarah, thank you for the heart. Right here, girl. Wait. Yeah, right here, girl. Appreciate you. So think about that. Use guinea pigs. If you're in peds and you have babies, use them as guinea pigs, right? Like I have an 18-month-old right now. So if I was in school right now, I'd be like, man, okay, we're talking about the toddler age. Yeah, he's fitting every damn step of that. I'm trying to get a heart rate. Nope, won't happen. I'm trying to check his breathing. Well, he won't let me sit there and look at him, but I know he's breathing because he's screaming, he's crying, he's agitated, he don't want to be in here. You see what I'm saying? It's stuff like that. What does it say? Let me just go up to him and tell him I'm gonna do a head to toe on you. Use a pillow, use parents, neighbor. Exactly. You use the things that are at your disposal respectfully, right? And within reason. All right. I'll answer one more question. I already stayed over 5 minutes because Sarah got my full undivided attention. So one more question and then I'm going to hop off. I appreciate everybody being here. Y'all got me to 26,000 likes. Y'all shared a ton. I appreciate everybody. What else y'all got for me? Yes, Sarah, you are very welcome. I got you. I got you. So, all right. Well, looks like pretty much it says, thank you, Nurse Kev. You're awesome. And I'll see you Monday. Yes, ma'am. And I will see you on Monday as well. Hey, so if nobody else has any other questions, I'm going to go ahead and I'm going to wrap this up. Make sure you guys check me out on YouTube and all that good stuff. That link is in my bio. Also, if you or anybody else needs help with NCLEX and you're not graduating for another 3 months, 6 months to a year, check out the 7-day NCLEX course. Y'all, it's $48 and you get it forever. It's not a subscription base, not yet. And I have 42 content videos in there, 42. And I'm about to add a bunch more over the next week. Okay. So make sure you guys go over there and check that out. If you need one-on-one tutoring for NCLEX, also in my bio, check that link out and book a 15-minute call and come talk to me. Come talk to me. It's a 7-day NCLEX. It's an on-demand course. It's an on-demand course, and it's me that's doing all the teaching, right? And then, like I said, I'm working right now to the new generation NCLEX review. It's going to be 100 questions, and it's going to be me breaking them down and then giving you the rationales so you better understand how to tackle these questions and what to look out for. Okay. So like I said, that is on demand. But yeah, 7-day NCLEX course. Also, if you need tutoring, check out that link that is in my bio as well. And I'm going to leave you guys with this because, the weekend's coming up. Of course, be safe, take care of yourself, take care of your family. And the last thing I'll say is be kind to yourself. All right. There's a lot of shit that's happening in this world. We have people in here from Israel. And if you guys are living under a rock, you guys don't know what's going on in Israel and Palestine. I don't take sides. I'm very unbiased because, there's a lot of things that are happening over there. So be kind to yourself. Take care of yourself because there's only one you. Without you, you are good to no one, to include yourself. If you can't take care of yourself, you can't take care of your husband. You can't take care of your spouse, and you can't take care of them damn kids. Why? Because fuck them kids. I'm just playing. I love all my children's. Okay, all of them. don't call nobody on me. Okay. But yeah, make sure you guys take care of yourself. All right, because you only got one you, and if you don't have you, fuck everybody else. All right. Okay. That's all I got. Make sure you guys go check out all those things. I hope everybody has a good and safe weekend. If you're studying for your NCLEX, I wish you all the best. And I will see everybody on Monday at 5:30 Central Standard Time. Or if you don't live here in the United States, that would be Texas time because that's the only time that matters. So with that being said, bye.